Hello, I'm Dr. Daniel Vorobiof. I'm the Medical Director of Belong.life. Today we are going to talk about multiple myeloma. What is it? What are the symptoms? And what are the tests that they are required to be done? We know that multiple myeloma is a type of blood cancer of certain cells called plasma cells, which are found in the bone marrow. The bone marrow is a spongy soft tissue inside your bones that normally creates all the cells which are the components of the blood. Plasma cells are normally a key part of the body's immune system. In particular, they produce antibodies that help the body fight an infection. A myeloma develops when healthy plasma cells change due to a number of triggers and they grow out of control. As a result of that, the bone marrow and the nearby bone tissue become compromised, and with time, this slow process may result in multiple bone lesions that eventually and over the time increases the risk of bone fractures. These abnormal plasma cells can crowd out or stop the growth of other normal cells in the bone marrow, such as the red, the white blood cells, and the platelets. Myeloma cells are unable to produce healthy, functioning antibodies to fight their infections. Instead, they make what is called a monoclonal protein, or M protein. That protein can build up in the blood and in the urine, potentially damaging the kidneys and other organs, as well as reducing the immunity. Myeloma is usually called multiple myeloma because most people, probably 90%, have multiple bone lesions when diagnosed. This happens in long bones such as the femur, as well as in flat bones such as the scalp and others. People with multiple myeloma may experience a number of different symptoms and signs. Sometimes people with multiple myeloma, they don't have any of these symptoms, and their cancer may be discovered by a blood or urine test which is performed for a different reason, such as an annual physical examination. Bone marrow cell suppression by plasma cells may result in different situations. For example, anemia from a shortage of red blood cells, excessive bleeding from a shortage of platelets, reduced ability to fight infection from a shortage of white blood cells, fatigue, usually caused by anemia. Bone pain is a common symptom due to local bone damage or generalized thinning of the bone, which makes the bone more likely to break. If it affects the spine, the vertebra can collapse. This is called a compression fracture, which can cause pain, numbness, weakness due to the tumor or the mass pressing against the spinal cord or pinching a nerve coming out of the spine. Also, the excess of M protein may lead to kidney damage or failure, an important issue to be aware of. Hypercalcemia is a high level of calcium in the blood. That can happen as a result of bone breakdown. And some symptoms such as weight loss, nausea, muscle weakness, and even mental confusion are related to hypercalcemia and also to kidney failure or other blood chemicals imbalances. Fever and infections, especially of the upper respiratory tract and the lungs, may arise as a result of the lower immunity. In order to find out what the problem is, your doctor will, after examining you, order some tests, such as blood and urine tests, and will measure the amount of M protein in the blood or the urine by a specific protein test called electrophoresis. Also, the immunoglobulin levels are measured to check the amount of antibody levels in the blood, and they are the immunoglobulin G, A, and M. When protein is found in the urine, this is called the Benz-Jones protein. There are other blood tests and urine tests that the doctor will perform, such as beta-2 microglobulin, as well as kidney functions, calcium levels, and blood cell counts. The doctor also may perform some x-rays. X-rays of the skeletal system are usually and typically the first step in evaluating the bones when the myeloma is suspected. Other imaging procedures such as MRIs, CT scans, and PET scans might contribute to the diagnosis too. A bone marrow aspiration and biopsy is very important. These two procedures are done at the same time to examine the bone marrow. The bone marrow has both a solid and a liquid part. The bone marrow aspiration removes a sample of the fluid, the liquid part, with a needle. And a bone marrow biopsy is a removal of a small amount of solid tissue, also using a needle. A common site for a bone marrow aspiration and biopsy is the pelvic bone in your right or left backside. Thank you very much for listening, and we will promise to bring you more information on multiple myeloma in our next issue.